Select the disease, relax you want. बंद करो दस दिन तक नहीं तस खैर ना तस्वीर बस ऐसे आवर इधर तजान okay, this is the echocardiogram of a person which is male patient. Name is Muhammad Kashif. The age is 37. He is a labor in Malaysia for the last of so many years. There is a on the echocardiogram. What are the findings? There is no history of congenital heart disease and no history of rheumatic heart disease. Okay. He is not smoker, non-alcoholic, and he is not living at high altitude. My name is Dr.Ghulam FAROOQ. Sorry, we are from Pakistan. This time today is 16 September 2019. The patient today is come at my clinic. He was seen at Malaysia, and this is the short record of the patient. Okay. There is a hospital letter to hospital Islamabad, Ministry of Health Malaysia Hospital, SERUME referral letter. Okay, and that referral letter is on August 2019, 27. Okay, this is the letter. And this procedure performed for the typical AVNRT and also right-sided CTI dependent atrial flutter. In CTI ablation done in May 2018, and that is Cardiology Hospital, SILDENAFIL Hospital, referred to Hospital Islamabad. Dear doctor, thank you for seeing this patient. Okay, and a 36 years Pakistani gentleman married to Malaysian lady, work as security contractor. Okay. That is the patient investigated everything, serum electrolytes and all the calcium, magnesium, phosphate, creatinine, coagulation profile, everything is there. Okay, lipid profile also hematocrit and absolute okay, imaging indication atrial flutter, background of chronic pulmonary embolism and pulmonary hypertension. Very dilated RA with the RA 71 square centimeter. RV this intracardiac signal from Dudica suggestive of atypical reverse atrial flutter. Flutter spontaneous terminated and catheter manipulation procedure stopped, sheath removed and hemostasis achieved. Okay. And VQ scan conclusion, pulmonary embolism within one segment of left upper lobe and subsegment of the interior basal segment of the right lower limb, right lower left lung. Percent of pulmonary vasculature involvement is 10%. Multiple abnormal ventilation areas with preserved perfusion is due to underlying alveolar disease. This is very, very interesting. Why someone mentioned multiple abnormal ventilation areas with preserved perfusion is due to underlying alveolar disease. Anyone know why underlying alveolar disease? CTPA is 7-8-15 pulmonary artery well obstructed is dilated, small filling defect in the left descending pulmonary artery suggestive of embolism. The patient is put on BOSTAN 62.5 milligram and SILDENAFIL 50 milligram BD. Self-purchase WARFARIN 3 milligram UD and TESOPROLOL 2.5 milligram UD and pantoprazole 40 milligram UD and LASIX 40 milligram UD tablet in the and spironolactone 50 milligram UD. Okay. After that, the patient, this is the third phase. The patient is on Plogonil 200 milligram and also Prindopril 2 milligram. Prindopril is no ACE inhibitor. Our long-term plan, okay, for medical therapy in view of with multiple scoring cardiac tissue. Our long-term plan that plan from Malaysian cardiologist for medical therapy in view of with multiple scoring. Okay, here is sorry, my mobile for BT is going down, but I am trying to explain more. Okay, there is anti-phospholipids DVT 2010 right side of the femoral and DVT 2013 left side. Bilateral deep venous thrombosis. Bilateral deep venous thrombosis. Okay, in the right side that occurred in 2010 and DVT of the left side in 2013. Then in 2015, look on this, everything is there, was anti-phospholipid syndrome 2016. EP for CTI dependent Holter typical 2018. Okay. This is very interesting. In 2010, right side pulmonary, right side DVT, and then 2013 left side, and 2015 diagnosis anti-phospholipid antibody syndrome. Anti-phospholipid syndrome. There is also someone mentioned sleep apnea and patient on CPAP. Okay, so this is a CTPH and atrial tachycardia. Now chest. Okay, this is the patient here as we will examine. Just you look this. Look, this is the okay. Look on the limbs. Okay. The patient at present is on. The patient is on 4 medications. Okay. That medication is okay. The patient here in Pakistan, someone is put on SCQ and WARFARIN 5 milligram, and also on CALAN verapamil 40 milligram BD, and SILDENAFIL in the name of Viagra 50 milligram BD, also BOSTAN, which is actually BOSTAN that is 1 plus 1. Here is not someone mentioned what is the stent, but that is 62.5. And that is, patient is also on 50 milligrams spironolactone along with 40 milligram furosemide. And the patient is put on lisinopril 2.5. Okay. This treatment, that is just September 2019. Just today is 16, and this is just 14 days back at some tertiary care unit, KPK, Khyber Pakhtunkhwa, Pakistan. Then when someone, that was the echo, someone given an echo, there is a normal LV systolic function, dilated right side chambers in severe pH. But here with me, my name is Dr. FAROOQ, as I mentioned, I am a cardiologist. There is severe MR, severe TR, and also mild to moderate MR. So my questions, when someone is receiving warfarin, what will be the side effect of warfarin? Okay. The first question is this. The first question is even why he is suffering of antiphospholipid antibody syndrome, which is autoimmune. Anyone can answer? Because here we will be sharing the knowledge. We want to learn from one another. Because sharing is caring. One can learn from one another. Because I am nothing, because the patient is seen by a center which is called MALYSIA. So many people are trained there with the source of so many people, great people in Pakistan. One of them is Professor Asadullah Kundi. Because he's Muhammad Ali Ruzli is the best friend of Professor Kundi, and I know Muhammad Ali Ruzli is very, very nice man, is very, very lovely person. Anyhow, why the patient is on calcium channel blockers? When someone has pulmonary hypertension, and as the right side pressure will be decreased with the diuretics, and Busantan side effect. I am here asking especially why the antiphospholipid syndrome, why there is hypercoagulable state, why the patient on SCQ 200 here in Pakistan, not in Malaysia. Someone is put here in Pakistan on SCQ 200 milligram and delta is verapamil 40 milligram, which is not given in Malaysia. And warfarin is continued, Viagra is continued, and Busman, spironolactone 50 milligram, and lisinopril 2.5. But the patient is not improving. You can English?
A little bit.
Kashif, are you improving for the last of 9 years? You are suffering of the diseases which you know very well. Are you improving with medication or you are the same?
I'm same, not improving. Only improve my problem is most going to the difficult way.
To deteriorate. You are not improving.
Not improving.
With passage of time, there is no improvement and
Not improvement.
okay. I wanted to ask some question from you. Anyone advise you to use sunlight on skin directly?
No.
Okay.
Not anybody.
Anyone mention you about the side effects of warfarin?
Nothing. Everybody tell me that you can use the offering until I take every day I
Okay.
take the
Okay.
offering.
Are you in the life use any sunlight on the skin?
Like normally, not because I'm working.
Are you know vitamin D?
I don't know.
Okay, you don't know the source. Okay, this is very, very interesting. When he's come to my clinic, I perform that chest X-ray. Just look on the X-ray. Okay, this is very, very interesting. First of all, I'm cardiologist, but I am looking why we are suffering heart attacks, why we are suffering of CVA, and why we are suffering of diseases, why we are suffering of obstructive coronary disease, even arterial obstructive diseases like carotid artery disease and coronary disease and peripheral vascular disease. Due to plaque, why we suffering of stroke. Even I am asking, I am very interesting, why we are suffering of diseases which is not from the God, which is not from the real God. Because there is no such disease in the Quran, and there is no such disease in Torah, and there is no such diseases in Zabur. These are the correct, 100% correct books from the God. Because we are banning some diet for the patient, especially cholesterol and meats. Anyhow, that is not banned by God. As is mentioned in Torah, when the God asked Jews, you can eat all the things, but not the things which you, the meat of folk, and when there is no Allah Akbar on that. When they refused, the God banned fats and meats in Torah. In Quran, Surah Anam, which is called Cattle Surah, and ayat number, in ayat 146, the God says, وَعَلَى الَّذِينَ هَادُوا حَرَمَنَا وَعَلَى الَّذِينَ هَادُوا حَرَمَنَا كُلَّ ذِي زُفُرٍ وَمِنَ الْبَقَرِ وَالْغَنَمِ حَرَمَنَا عَلَيْهِمْ شُحُومُهُمَا إِلَّا مَا حَمَلَتْ. I am not so good to recite the Quran because we are so very weak. But anyhow, so here, regard you can just use shahumahuma fats, which is attached to the entrails and bones, but no other meat and viscera. Then the Muhammad Sallallahu ask Jews ki you can use, but they reply ki no. Then Muhammad Sallallahu asked why. Then the Jews reply ki that was advised by Israel ki you cannot people use these things. So our Pathan people, our basic root is a Bani Israel. In their time, there was special diet from the God, and that was refused by Bani Israel. So when we have checked the when the vitamin D discovery that butter is given to the rats, and the rats become healthy and the vision become improved. When they heated that butter, the rats become blind, but they were healthy. That is called substance D or bone vitamin. Then it was criticized by German. And then the first heart attack, that was in 1930. And there was so stress to keep the cholesterol low in 1970. And now this is 2019, and just 7 months back there is guidelines from American Heart Association. One can use cholesterol. We have just lost $2 trillion on the cholesterol lowering drug. So then why we are suffering up again arterial obstructive disease? Because everyone is there is different presentation in the cardiac society in different countries like CTC, TCT, and SCC, NHA, and EuroPCR. Significant vitamin D deficiency significantly associated with cardiovascular diseases and infectious disease and autoimmune disease. So, if we think why that cholesterol not remember when they was given to the rats, actually that is the 7-hydrocholesterol. When it's hit by the ultraviolet B rays in the skin, that 7-hydrocholesterol is converted to pre-vitamin D3, and that pre-vitamin D3 converted to D2 in the liver, and then to the active form in the kidney, and they come to the intestine. So they absorb the calcium and magnesium, and everyone know what is the function of the calcium and magnesium. When ultraviolet B rays not used on the skin, that 7-hydrocholesterol is changed to cholesterol, and there is increased cholesterol hyperlipidemia, and everyone know the consequences of hyperlipidemia. So when there is a deficiency of vitamin D or bone vitamin, the parathyroid hormone is increased, and so increase the excretion of the calcium in the renal tubules. So we are suffering of renal stones. And as there is no source of calcium in the body, that parathyroid hormone remove the calcium from the bones, and so we are suffering of rickets and premature osteoporosis, osteomalacia, back pain, joints pain, teeth problem, and such. If you look on the X-ray of this man, just look on the bone density. Just look on the bone density as severely loss of bone density. And this is the X-ray of 16 September 2019, the time 5 this, and this is Muhammad Kashif, and this is a Temargara Dir, which is a district of KPK, and KPK is the province of Pakistan. And look on this cardiac shadow. Okay, this is the right ventricle, as everyone know, and look on the left side. Okay, and this patient is suffering of gynecomastia, which is everyone know that is the side effect of spironolactone. But look on the lab report today here, because this is a routine checkup of every man, of every person. Look on the level of hemoglobin is just 13.7, and RBS non-diabetic, renal status is normal, okay, and cholesterol is 160, and H. pylori is non-reactive. Oh my God, the level of vitamin D is unrecordable, less than 8. Less than 8 vitamin D. What a critical vitamin D deficiency. What a critical vitamin D deficiency. Critical. Because the level of vitamin D should not be less than 47. They are damaging the bone. And the research, when the level is less than 105, the life survival is decreased 13.6 years. I'm sorry, I'm feeling some tiredness, because we are checking here the patient, just 20 or 30 patient, but 20 maximum 20 or 15 patient, but we are giving 1 hour to each patient to detail about how the human being come to this world, and then how they can grow, he or she. So my name is that warfarin blood thinner, so that vitamin D absorb the calcium which is making the bones, and they also absorb the zinc, so they're making the immune system. That is the reason we are suffering of infectious diseases. And that sunlight also stimulates the lymphocyte from the dermis, and that is the main weapon with human beings against infection. As vitamin D also absorbs the magnesium from the small intestine, and that magnesium deficiency leads to tachycardia and torsade de pointes even, and depressions, and muscle weakness, and nerve weakness, and sweating, and hair fall, and phobias, and depression, and bad taste in the mouth, and cochlear nerves weakness, so some deafness, vestibular nerve weakness, so dizzy spell or vertigo, and headaches, and sleep apnea. Okay, that is very, very good lecture from some Tasha doctor, an American. She's laughing. Why we are suffering of sleep apnea? When she delivering this lecture, she's laughing. What did she take? Because she's sleep specialist. She telling this very, very interesting lecture, about 1.5 hours. CPAC is nothing. She's laughing. Because my patient who LV is normal, MR not so severe, and she's suffering of bilateral edema. That calcium channel blocker retain the fluid, and he's also on SCQ. So inshallah, we will be just keep this patient on warfarin along with low dose of BOSTAN. And as everyone know, calcium channel blocker be given very, very carefully when there is no vasodilator test. Okay, I'm sitting in Temargara for the last 4 years. I am FCPS cardiologist and 28 months intervention cardiology at National Institute of Cardiovascular Disease in Pakistan. Because I have learned a lot from my teacher, and everyone know in the world, National Institute of Cardiovascular Disease is the mother institute of Pakistan, and now is the #1 in the world, and especially in primary coronary intervention, primary PCI. That is top, which is even free of cost. Because that there are so legend people, just like Nadeem Kamal, Nadeem Ruzita as Sagir. So all the teamwork, yes, that is the teamwork. And unbelievable. But in ICVD, 80% procedures are free of cost. So I am proud on that institute. I have learned a lot from that people, and even I am thankful to all the people in the world. We have learned from the patient. We are learning from the patient. So I think we are suffering of diseases. In the world we are suffering of diseases 80%, which is not from the God, just from the human beings and the human beings. So that is the reason we are suffering of health problems, social problems, and huge loss of money of government, public sector on health problems, which are not from the God, 80%, just due to some wrong research of the human beings. Okay. So when someone is using blood thinner, as everyone know, warfarin lead to osteopenia because they remove the calcium from the bone. And as parathyroid hormone also remove the calcium from the bone. And this patient is not on vaccine, H influenza vaccine. But as the UK research in 2016. Vitamin D is 6 times potent did the H influenza vaccine. Unbelievable. Because my age is 52, but I have no flu, just two for 2 days and 53 months. But that was a time, that was 2008 to 2012. I was suffering of dry cough. And then 2015 in April, when I first checked the patient vitamin D level, that was 2.5. And in June 2015, we have collected data of 600 patients. And my mother was dying at age of 64. But I remember my mother, her age was just 64, but she was suffering of dementia, and there was bowing of the tibia. And itself, I have faced severe vitamin D deficiency for 15 years with frozen shoulder. Then, as the vitamin D discovery is very, very interesting in the medical literature, when they are invented by the European, the German criticized. One can read that article, Discovery of Vitamin D. Then after that, the German also accepted, because the German actually Pathan. Germany are actually Pathans. That is the reason there is some sunny OPD in Italy and Germany. When the rickets babies in the summer, they are exposing their children to the sunlight. And also in World War II, when Germans become injured, they exposing the wound to the sunlight. So we don't remember our old culture. And so everyone know vitamin D is the only hormone or vitamin which is synthesized by the body when the sunlight hit the skin basically, and that is the cholesterol which is changed to cholecalciferol. So God is so mercy, because the sunlight not increase the level of vitamin D to a level which is called toxic level. If someone using vitamin D in diet form, natural vitamin D, and using sunlight, there is no toxicity. But if someone using artificial supplement and using sunlight on the skin, they can lead to toxicity and hypercalcemia and the consequences of calcemia. So look, the God, the creature of this world. One can eat all halal and just use sunlight on the skin. As the world is divided into three, we are living in Pakistan. Pakistan, two zones is tropical zone and temperate zone. From Islamabad to Chitral, that is called temperate zone, the ultraviolet B rays significantly decrease from November to April. But in Karachi to Lahore, all the time in ultraviolet B rays. But ice zone or frigid zone, that is Norway and Canada and Panama, and the ultraviolet rays, ultraviolet B rays significantly absent for the last of 9 months. So that is called of angle of zenith, AZ, angle of zenith. That is the angle which is the sky touching the earth. When that angle is decreased, the ultraviolet rays is decreased. But when that angle become high, the ultraviolet rays is increases. So I invited all the people from those countries of the world which have no very very less sunlight, deficient with ultraviolet rays, come to Pakistan, and we are human beings, we have sunlight, we are people which have love from the core of the heart. Thank you. This man inshallah will be improved because he's suffering of severe vitamin D deficiency. The weight inshallah will be decreased in 6 months, and that fluid will be lost because this is not due to heart failure. This fluid is just due to calcium channel blocker and due to sedentary life. Because my patient is unable to walk 1 kilometer, then that lead to bilateral edema, not due to heart failure. And the right side heart failure is not lead to such edema. If you go, the GVP is okay. My patient I have already examined, the GVP is not raised. Okay, look on this. So the GVP raise means only the right side heart failure, but the right pressure is increased definitely. But the look on the lower limbs, okay, this is also post-DBT syndrome, but inshallah this will be significantly improved, and we will be show again in this word. Because as everyone know, if there is R and T phenomena, just look on this ECG. As in mentioned in Quran, Zaikatul Mawad. If you look on this ECG, this is called R, and this is called S, and this is called T. Okay, in this area is just 2 milliseconds. But when this R is come on T, when this R hit the T, that is R in T phenomena. And that R in T phenomena, everyone know what is the consequences. If someone not do something within 10 minutes, can die 100%. If someone do something within 2 minutes, 80% survival. It means survival is decreased with every minutes. So, in short, the cardiology should be active just like heart, because the heart all the times are beating, and because the heart is the only organ which is beating, so the cardiology should be active like heart, and that would be not miss anything. Should be try, because the God say human being have Broca's area, and we will be used properly that. We should be take the history in the lifestyle, and we should be check the diet. Okay, thank you very much. This is the father of the patient, and this is the son of the patient, and inshallah thank to that Malaysian government, okay, they are caring of Pakistani people too much, because Muhammad Ali Rusdi is very very nice person. Anyhow, I have no book that tips and tricks of cardiology. The first name, there is 65 people, and the first main author is Muhammad Ali Rusdi. Because I already know at 2006 when he was at NICVD for the conference, and after that, at that time he was accompanied by some men. Then Professor Kundi tell me this is Rusdi. He's very very simple man. As cardiologists should be caring, because the people expect a lot from the cardiologists, because they we cannot save the life, but we should be try. So thank you for listening this, and sharing is caring, and we should be sharing the knowledge to learn from one another. We are human beings, and human beings should be suffering of mistakes, and that mistake should be corrected by colleagues. Thank you very much.